Thank you for the introduction. My name is Brandie Nonnecke. I'm a postdoc at the Center for IT Research in the Interest of Society at UC Berkeley. I'm also the Program and Development Manager of the Data and Democracy Initiative. So an overview of what I'll talk about today. I'll give an overview of CITRIS and the CITRIS Data and Democracy Initiative, and then I'll share with you two projects we're working on right now, the California Reportcard and the Uganda Collective Assessment and Feedback Engine project. So CITRIS is the Center for IT Research in the Interest of Society. It's multidisciplinary and it's multi-campus. CITRIS seeks to develop IT solutions to some of society's most pressing problems. CITRIS spans across 4 campuses, UC Berkeley, Davis, Merced, and Santa Cruz. Annually, we get about $4 million in funding from the University of California, which we then translate to about 90 to 115 million each year. There are 80+ faculty associated with CITRIS across the 4 campuses, and then we also have the honor of helping start 41 startup companies. I don't know if any of you are interested, but we do have an incubator associated with CITRIS for emerging companies and projects. It's called the Foundry. So if you're interested, please talk with me afterward, and I can give you the information for the individuals who run the Foundry. There are 4 core initiatives associated within CITRIS, and this spans all 4 campuses, not just UC Berkeley. There's the Healthcare Initiative, Intelligent Infrastructure, Energy, and Data and Democracy. I'm the postdoc for the Data and Democracy Initiative. There are 2 other postdocs who assist in the other initiatives. The Data and Democracy Initiative was established in 2011, and we seek to develop social innovation tools that foster participatory assessment and collaboration, mobilize individuals to reach out about pressing social, political, and economic issues. The Data and Democracy Initiative faculty director is Professor Ken Goldberg. He is in electrical engineering and computer science. The director of DDI is Dr. Camille Crittenden, and she is also the deputy director of CITRIS as a whole across all 4 campuses, and then myself. We have a 10-member advisory board, and our advisory board spans many different fields, from the lieutenant governor to Michael Cohen, who started Open Town Hall, an online platform for civic engagement. Today I'm going to discuss our development of participatory tools that seek to encourage assessment and feedback. And the origins of our project are from this project called OpinionSpace, where we try to look at, instead of soliciting feedback in a list-based approach where you gather feedback sequentially, we are developing a new way of gathering ideas and presenting those ideas to others in a more judicious way. And I'll explain that more later. Our 2 current projects, the California Report Card and Uganda CAFÉ, also integrate the World Bank Citizen Report Card. And using these 2 approaches, we are able to gather quantitative and qualitative feedback. Actually gather some really great insight from the combination of these 2 data sources. So typically when gathering feedback, most of the time you have a list-based approach where you just call out for people to give you feedback and you pull it in. Everybody gives their feedback. But that can become very unwieldy if you have a very long list. Let's say you have 10,000 people who give their idea. How do you sift through that list of 10,000 ideas to be able to draw a conclusion from that list as a whole, or to even see what is the most insightful idea? Is it buried clear down at the bottom? Is it the 898th comment submitted? So we're developing a tool to help with that. The other way of collecting data could be doing a program assessment and asking people, was it successful or not? A dichotomous way. Yes, no, support, do not support. But of course with that you have very limited data. The data is not very rich. You can't really decipher and come up with really great insights from a list if you're just getting a dichotomous coding of support or not support. Of course, we're not the only people who are developing these tools. There are many other great minds who are also working on this project, so we should always pay honor and homage to who else is developing these. The objectives of these social innovation tools, I believe, are twofold. the overall goal is to encourage collaboration between leaders and communities. And for communities, our tools, including the California Report Card and the Uganda CAFÉ project, and the tools I presented on the previous slide, is to encourage people to be able to kind of voice their concerns, even identify what their concerns are, express those to others, and be considerate of divergent viewpoints and have their voice heard. And then on the other hand, for organizations, including governments and non-governmental organizations, they can really increase efficiency by crowdsourcing ideas from the constituents they serve directly. It's really a win-win relationship, but we can do it in the right way. So we're trying to develop tools that do this in the right way, or potentially in the right direction. So our two projects, the California Report Card and the Uganda CAFÉ project, stem from the same project. I mentioned it earlier. It's called OpinionSpace. OpinionSpace was developed at UC Berkeley in 2009. And instead of presenting, actually, I know I can't stand in front of the screen because you'll lose me, so I'll try to point here. Okay, well I can, yeah, so on my video, maybe I'll disappear now. So within our platform, each orb is somebody's idea. They go onto the system and they put forward their idea. That idea appears in the system as an orb. The larger the idea, the more supported that idea is, because other participants can rate the importance of that idea. This iteration was used for the US State Department to solicit feedback on how social media could be used for international relations. So instead of having a list-based approach and saying, please give us your feedback on how social media could be used for international relations, we use this other method where everybody's comments are displayed. You could easily click on this idea or a smaller idea here just to check it out instead of having to scroll through that entire list. In our two current projects, we also incorporated the World Bank's use of citizen report cards. So citizen report cards have been in use since 1993. It's a way to gather feedback on the performance of government interventions or agency interventions. Also within the citizen report card method, you use a familiar metric, and they use a grading schema of A+ to F, which we also used for the California Report Card. So the California Report Card is a joint project between the CITRIS Data and Democracy Initiative and the Office of Lieutenant Governor Newsom. We started it in fall of 2013, I believe. And the goal is to really enhance communication between elected leaders and their constituents. And last week on Tuesday, we launched another version, a new version of it, where we have I want to say instant translation, but we have people behind the scenes helping out with the translation, but between English and Spanish, because 30% of California's population, their primary language at home is Spanish. So we want to be able to reach that population. And then, of course, instead, you shouldn't try to develop a civic engagement tool that's just in English and just in Spanish. Can you guys tell me why? This is part of a class. I'll solicit feedback.
You don't get the Spanish and the English people working together.
Very good. Yeah, what's the point? You don't have the two communities collaborating and working together. You don't want to create silos of communities and further this separation. Very good. So here are some screenshots of the new version of the California Report Card. There are three main portions of the report card: assessment, ideation, and collaborative evaluation. The assessment phase is where we've really drawn on the World Bank citizen report cards. Here, it's a bit hard for you to see. So if you can see here is one of the policy issues. There are 6 policy issues. I didn't include all 6 screens, of course, for space, but participants click a letter grade from A+ to F on how they believe the state of California is performing in that policy area. Participants can also skip any issues that they do not feel comfortable answering by clicking here. So this is our assessment phase. After putting in their grade, they enter this space that we call the ideation space. So once again, we're using this sphere metaphor. Each sphere represents a participant. We obviously shouldn't put all spheres on there at one time, because we also built this tool to be on your mobile device, and if all contributions were on there, it would just be a pile of spheres and we'd have that problem. So we actually use an algorithm on the back end to load the system with suggestions that have received fewer ratings. That way we get an even rating for all comments, right? Instead of that list-based approach where comments at the top, because they're at the top, they will receive more ratings. Our platform really tries to mitigate that problem. So once you click on somebody's sphere, you can actually assign a grade on how important that policy issue is to be rated on the next report card. And I can share some of the results in a minute. And if you're interested, I have a lot more detail about the results at the end and some extra slides if you're interested. So after participants rate others' ideas, they're asked to put forward their idea for an issue that should be included on the next report card, which is the last slide. Our platform we built using HTML5. That way it's cross-platform. You can use it on your mobile device, desktop. It scales. And then also government involvement is definitely key for developing a civic engagement tool. If you're trying to solicit feedback from people about a policy issue, it's really important to be able to say your contribution on this platform matters. And we do that by working in collaboration with the Office of Lieutenant Governor. And we actually write a report about every 3 months on the data, and we send that to the Office of Lieutenant Governor for their review. The first 6 issues that we have included on the report card: implementation of the Affordable Care Act. So these are the issues participants rate from A+ to F on the state of California's performance on these issues. If you're interested, at the end I have the actual grades for each of these, the median grades calculated from all participants. So you can see which issues you think California is performing well on or not versus the median score of the group. So since we launched the first version of the California report card, and we launched that in early February 2014, we've had over 11,000 participants across the state of California, and they've assigned over 30,000 grades to the state of California. And I believe they've suggested over 500 issues. So what we found from the first iteration is that participants approve of California's rollout of the Affordable Care Act, but they're very concerned about the quality of education in the state. What was actually really interesting, and I had the privilege of looking at every suggestion that was put into the system to make sure that it was appropriate for the system. What was really neat is that there was quite a few people who thought that the state needed to be better prepared for disasters. And so we were able to express that information to the Lieutenant Governor. And at a public event in March 2014, we were able to tell him, we're seeing from this feedback across the state of California, all 58 counties are represented, that there is increased need for disaster preparedness in this state. So I encourage all of you to go to californiareportcard.org and register your views on the state of California. Okay, so Uganda CAFÉ. So a little bit of background information. Well, we implemented the project in the Kamuli district of Uganda, which is located about northeast of Kampala. And the Kamuli district of Uganda, I've been working in the district since 2007 doing research. And the Kamuli district faces many, many development barriers. The people in this district, and the district is one of the poorest districts in the country. These people are subsistence farmers, meaning they grow what they eat. If they have a bad growing season, they don't eat. Also, I looked up some statistics from the World Bank the day before yesterday about Uganda, and I think about 48% of the population is between the ages of 0 to 14. And then, because this is on family planning and reproductive health, 24% of women ages 15 to 19 are currently pregnant. So think about that. It's a very booming, growing population that is already facing huge development barriers. So I've been working in the Kamuli district since 2007. My husband and I started a program called Establish and Grow in collaboration with Iowa State University and a local non-governmental organization. And Establish and Grow provides emergency nutrition interventions for mothers and children in the Kamuli district. We serve about 300 women, and there are 3 locations. In addition to providing every day, Monday through Friday, we provide nutrient-dense porridge because these individuals do not have access to nutrient-dense food sources. The main diet that they eat is cassava, which is a tuber, very low nutrients, and then also maize. So every day, Monday through Friday, we provide this nutrient-dense porridge for pregnant mothers and children. And we also offer immunizations for children and training to increase household income, and also training on growing more nutrient-dense food crops like green amaranth, beans, soybeans. So we decided that it would be really interesting to apply this collective assessment and feedback engine in rural Uganda to assess our intervention at this nutrition education center. So Establish and Grow started in 2007, but the centers didn't open until 2011. And in 2011, we started family planning and reproductive health trainings. So even though we've been doing these trainings now for 3 years, we're still seeing back-to-back pregnancies among women participants at the centers, which is an issue because they wean their children early, and then the children become extremely malnourished while the mother is pregnant. So for me personally, I really wanted to go in and be able to solicit feedback on, well, what is or isn't working about the family planning and reproductive health trainings. So that was our first goal, and then also to identify how the nutrition education centers could be improved as a whole. And I was going to say, I went in last summer, and these are some photos I took of women using the platform. So here are some screenshots of the platform. So your first alarm bell should be, this is written in English, right? They don't speak English, they speak the local language. So I did all of the interviews with a translator. I've been working in this community since 2007, so I know all of the women, and the women are very comfortable with me. And we did the interviews together. But really our goal was to test the platform to see if we could use something like this there to be able to collect data. We can also, and I should say, this platform can be used offline. You don't need to have the internet to collect data. Everything can be local on your computer, which is how I collected the data while I was there. So we collect demographic information here, the age of the participant, whether they're married, their number of children, the number of children they want, the number of family planning trainings they have been to in the past year. And then we also collect, using the World Bank Citizen Report Card method, an assessment on 6 factors. The first 3 factors are autonomy, which in the research literature, the level of autonomy of a woman is directly related to her ability to adopt family planning methods. So we had 3 questions to assess the woman's autonomy, and then we had 3 questions to assess her fear of contraception, different methods. In this community, we're finding there are very entrenched deep fears of different types of methods. And even though we're continuing our trainings, and trainings are offered every Monday, not all women go to every training, but they're offered every Monday, they still have these fears that continue. So we're trying to assess how deep are these fears. And then in this iteration, we used the coffee cups. So each participant's idea is represented as a coffee cup instead of a sphere. I was able to see this. The participants weren't. Then we asked the participants to give a suggestion for how the centers could be improved and why. And they could rate each other's ideas. So what I think is actually really unique, and when I sat down with participants, we've been using red as negative and green as positive in all of our teaching materials that we use at the centers since we started. And so they were actually able to point on the screen and tell me where they thought in agreement, which I think is neat for the next design iteration. I now know the numbers, so we're trying to use a Likert scale. I need to remove the numbers from left to right and just have the color. So there are some new additions we will be adding. and then we solicit their suggestion.
So the suggestions are offered orally and then you type it down? Or?
Yes. Yeah. Yes, exactly. So the next iteration, because the women are illiterate, we're looking at interactive voice response to be able to have the comments put in through voice, and then participants could click and listen to each other's ideas and rate. That way it's more participatory in that way. And I think it's very important that the women are able to evaluate each other's ideas, hear each other's ideas, and directly put in their feedback instead of through me and a translator. Good question. So data was collected from June 11th through the 21st. I did about 140 interviews with women, and the data was collected through the tool, but also through a paper-based format. Really, we didn't do all of them through the platform because it's very timely in doing it, and our goal this first time was to see, well, does the platform actually work, and how receptive are the women to inputting their data through a computer or a tablet. But what was really unique, I think, about the platform was our ability when I came back to be able to look at the data and gain insights that I wouldn't have otherwise necessarily seen. So pulling from the 6 initial quantitative data where we asked about level of autonomy and fears, we were able to see, well, that autonomy and fear affect adoption, which obviously makes sense. If they have higher fear, they're not going to adopt. Also, what was unique, attending family training sessions did impact their ability to adopt the method. And our 3 centers operate equally. So with the local NGO, all 3 centers receive the same materials, the same training. They operate in the very same way, but the impacts of the centers are different. We were able to identify that one of the centers is an exemplar. That center is very successful at reducing fears among women and increasing adoption. And the trainings are highly attended by participants. So there's the quantitative data, and then there's the qualitative data where we tried to solicit feedback from participants on how the centers could be improved and why. What I thought was really interesting, we offer trainings once a week on Mondays, but they still want more trainings. And they said, well, one reason is we are very, very fearful. Some of those fears include that if you take a certain type of birth control, you will develop cancer. You will become infertile for the rest of your life, even if you just take 1 tablet. And so they said in order for us to get over that, we really need more trainings, more intensive trainings. So this community, they are served by a local health center for the district, and I did visit the health center, and the health center is very overburdened with people who need to use the center. So one concern the women have is it would be great if we could get the same services that are offered at the healthcare center, like antenatal care, at this center. So that's something I actually didn't think about because I am here and I'm not there very often. I didn't realize how hard it is for them to seek out appropriate health care while they're pregnant or after their baby is born from the Bachanzi Health Center. And then, of course, I don't know why we didn't think about this, but including husbands is very important when you are trying to adopt family planning and reproductive health strategies, right? But in this community, we have struggled with including husbands in some of the sessions. Husbands are not excluded from the centers. They can definitely come, and there are some husbands who come, and actually we are opening 7 centers. So after we did this assessment, we noticed that these centers are actually overburdened. We have at least 100 people coming to each center almost every day to receive food. So we offered to open up now 4 more to get to 7, and one of those centers is actually run by a man, which is very cool. And by soliciting feedback directly from participants, we were able to gain insight that we wouldn't otherwise. I think about mobilizing husbands to attend training, and then incentivizing. Here it says to impress our husbands, please provide inputs or some type of income generating activity to bring them in. And then part of getting the supplies would be to attend a family planning training session with your wife.